Just a short while ago, we were told the Sisonke Trial in Gauteng is going to be ending tomorrow. In fact, the Sisonke Trial of vaccinations are going to be ending this coming weekend. Phase 2 for those over the age of 60 is going to get underway on Monday. But that was just an hour ago or so since I spoke to Heidi Jokos. Hello to you, Heidi. That's the conversation we had, that the Sisonke Trial is ending this coming weekend. But there's been something of an update. As you stand outside Charlotte Maxeke Hospital for us, it hasn't ended when it was supposed to, has it?
Yes, indeed, Gareth. We do understand that from a communique that has been sent out by the Sisonke Trial team that the Sisonke Gauteng update, rather, as of 14 May 2021, 10 a.m. effective immediately. All Sisonke doses have been allocated within Gauteng and they are no longer able to accept any walk-ins. Now, what does this mean? This means that as of 2 p.m. tomorrow on Saturday, they will not be accepting anybody with vouchers. We do know that initially Sisonke had advised those healthcare workers and support staff that had not been allocated vouchers yet to go to any vaccination centre and they would be issued with vouchers. Of course, we've seen an influx of people and they're of course overwhelmed with the number of people, and perhaps the 500,000 Johnson & Johnson doses that were allocated for Sisonke have now been allocated, and this is why they are no longer going to be accepting any more walk-ins. So we do know that phase 1 starts on Monday, phase 1B rather starts on Monday the 17th of May to public sector sites and 24 May to all private sector sites. So basically what this means, Gareth, there's a lot of logistical issues happening here, so we need to be very clear. Healthcare workers and support staff that do not have vouchers will not be able to walk into any vaccination centre. If you are a healthcare worker and support staff and you do have a voucher, you can go into a vaccination centre and hopefully be assisted. But as of 2 p.m. on Saturday, if you have not been assisted and you still have a voucher, you will not be able to get vaccinated. Part of the Sisonke Trial, you will move over to phase 1B, which will focus still on healthcare workers and support staff, so it will most likely overlap with phase 2, which we will see unfold on Monday, which focuses on those 60 and above.
And I imagine, Heidi, this story, the next angle of this story is going to be the disgruntled, the angry, and I'm sure many people would say the scared and panicking healthcare workers who were told from the very beginning. We had the health minister on this channel just a while ago saying all healthcare workers are going to be vaccinated, but clearly the numbers simply don't add up, and it seems the logistics can't support those numbers.
Yes, certainly. I think there is a great panic by a number of healthcare workers. Just to add to that point, Gareth, is that many healthcare workers have told us, have sent us messages that they are panicking because they're hearing about those who aren't healthcare workers or support staff getting the jab when they have still been waiting in the queue. When we speak about support staff, we speak about all those that work in any healthcare facility. So, for example, the security guards, the cleaners, everybody that provides a pivotal role in any healthcare facility are exposed and at risk, and this is why they need to be included in the Sisonke Trial or in phase 1B, which looks at inoculating healthcare workers. But it's important to highlight that Sisonke can only vaccinate 500,000. This is the allocation of the Johnson & Johnson 500,000 that we've seen brought into the country specifically for the Sisonke Trial. But just speaking about the numbers, I'm not sure how the queue is looking. Earlier on, the queue was all the way down, but it seems to be moving quite swiftly, and I think there has been a call out for people not to panic. But as you can see, there are still a number of people within the queue, and we are seeing staff coming through and actually asking everybody within the queue if they have a voucher. If they do not have a voucher, they've been asked to go back until a voucher has been sent out to them, and then that's when they can join the queue and get a jab. They've been asked to provide proof of employment, where they work if it is at a healthcare facility, and if also their ID and all of the documentation needed to actually get the jab. So they're trying to control the process as much as possible, but with the communication sent out by Gauteng Health, there is panic. People are concerned. Sisonke is ending tomorrow. What does this mean? But as Sisonke indicated, you will get vaccinated, even if it's not part of the Sisonke trial. It will be part of phase 1B.
All right. Heidi Jacos, thank you very much for the update. Glad to see that that queue behind you looks a bit more orderly than when you and I spoke about an hour or so ago. So that news just in a Sisonke Gauteng update. Sites with available doses and staff there will continue to vaccinate healthcare workers with vouchers and appointments until 2 p.m. tomorrow. Even if you do have a voucher and you are part of the Sisonke trial, after 2 p.m. tomorrow in Gauteng, you will not be helped. You will not be accommodated. It'll fall over to, as Heidi refers to it quite rightly, as a part 1B of the rollout starting on Monday.